Welcome. My name is Natalia Linos. I'm the Executive Director of the FXB Center for Health and Human Rights. And today we have a great discussion on reparation and health with two leaders in the field. To my right is Councilor Julia Mejia. She is the Boston City Councilor at large. And to her right, we have Dr. Mary Bassett, who is the FXB Center's Director, as well as the FXB Professor of the Practice of Health and Human Rights at the Harvard T.H. Chan School of Public Health. Dr. Bassett has worked extensively on narrowing black-white health inequities and increasingly has begun to explore how reparations could be part of that solution. And Councilor Mejia has been a leading voice in establishing the City of Boston's Task Force on Reparations. I could spend half an hour introducing them, but we're going to jump right into it. And over the next half hour, we're going to discuss the future of reparations here in Boston, as well as nationally, as well as what role public health has. I want to remind everyone that both our panelists do not speak for Harvard, and with their permission, I will be using their first names. So Julia, we're going to jump with you. Yeah. What are reparations? What does that term mean to you?
Well, thank you for having me. I'm really excited to have this conversation. When I think about reparations, I just automatically, most people think about financial. I think about reparations as the holistic repair of someone's social, emotional, and mental well-being. And reparations can come in many different forms, not just financial. It could be in the form of looking at policies and protocols and procedures, but really ultimately, when I think about reparations, I think about repairing harm that has been caused.
Thanks, Julia. And Mary, a few years ago, with the support of the Robert Wood Johnson Foundation, we started doing some work on making the public health case for reparations.
Right.
And I think you identified that in the conversations we had historians, economists, and public health wasn't really there. Why do you think we need public health experts in this conversation?
Well, first let me start out by saying how great it is that we're having this conversation about reparations here at the Harvard Chan School and broadcast out to the world. It wasn't so long ago that this would have seemed entirely unreasonable. And part of the reason that there hasn't been much discussion about the role of reparations in terms of its impact on health is that reparations was considered, even if you thought it was a good idea from a moral perspective, just not feasible and something that would never happen. And we in public health try to be practical. At least I'd like to think that we try to be practical. The other part of it is that, that there's been such a focus on addressing lifestyle that the policy purpose of public health has been lost, and the importance of taking policy positions that would advance health is often left to economists and to people in public policy. And I think that's another part of the reason public health hasn't been at it. But we have been part of the reason that people say we should have reparations. Everybody points to the disparities in health. What people haven't thought about is that this would be part of the solution. Mm-hmm. And that's what we've been trying to focus on at FXB, that reparations can be seen as a health intervention and not only a moral repair, but a way of addressing these long-standing health inequities. So that's a rather long, although I really think money has to be part of it.
Yeah, absolutely.
Let me be clear about that.
The investments have to be a part of it, right? So I think that there is definitely a role in that capacity. I grew up going to community health centers, right? And you are seeing right now that a lot of hospitals are being shut down. Pharmacies in historically black neighborhoods have been now under attack, if you will. And so I see that as also a very direct correlation between the impact that the world of health has a role to do in this conversation.
Thanks, and I want to sort of pick at your personal story. Like, how did you come to the point of saying Boston should have this reparations commission? What were the stories? What were health or non-health issues that came up for you? And what are some of your hopes of kind of this conversation?
Yeah. Well, I first came to this country. First, let me just say I'm an Afro-Latina, so I claim my black roots. In case anybody wants to know what that is, Google it. But basically what I know is that when they abducted our ancestors, the only difference really was the port that we were dropped off. But when we were talking about reparations, I'm very clear about there are some folks who immigrated here, and then there's some folks who were brought here. And there's a very distinct conversation in terms of who it is that we're going to really be uplifting when it comes to reparations. And so in 2021, in collaboration with the NAACP, Tanisha Sullivan, the president of the NAACP, had reached out to me and said, given what was happening with George Floyd and everything that was happening in COVID and all the health disparities, I had the audacity to introduce a hearing order to start looking at reparations here in the most racist city in the country, Boston. So it was definitely the conversation to be had. And here in the city of Boston, State Senator Owens was the grandfather, if you will, of reparations. He was the one who introduced reparations, 30 to 40 years ago here. So we were just picking up his legacy and really carrying that baton. But I think when we're looking at the city of Boston, there's a redlining. I went to traditionally under-resourced schools. I barely graduated, but made it out. But those were all cases of underinvestments in Black neighborhoods, right? And so when we're talking about the case has already been laid out 50 years ago. We're just catching up to the discrepancies that exist. And so it was really about the timing right now.
Well, thank you for having the audacity. And Mary, I know you served at New York City's health commissioner and then New York State's health commissioner. And so, is the Boston story similar, different in terms of where are there? I want us to center this on Boston, but I feel like your New York City experience is really relevant here.
True, and I've just learned that Councilmember Mejia has also had a New York City experience. So
I'm Red Sox, though, just in case.
So I would say one thing that should be clear when we're talking about the legacy of enslavement, which is really the origin of the conversation around reparations, that people often think that the northern states weren't really that involved in it. But that's not true. It's certainly not true for New York and Boston, where the profits from the slave trade were very important to both cities. So that's something that's similar. And of course, that has cast a long shadow over all people who are descendants of enslaved people. Who were brought here against their will from Africa. So I think that there are a lot of analogies. They're not completely the same. The Black community of Boston has long sort of punched above its weight in terms of its impact on the national scene, but it's a small population compared to New York City. And that may be why New York State has now moved to establish a statewide reparations effort, but certainly Boston was ahead, and I think you can take some credit for that, Councilor.
I'm taking all the credit for that, because it was not an easy task to first have the hearing order, and there was a lot of competing interests, and we had a lot of coalition building that we needed to do. But you know what? Dr. Bassett, I think it's
call me Mary.
Okay, Mary. Okay, Mary. That I really do think that when we look at Boston and its historical context, is that even though there's not as many Black people living in Boston as there is in New York, the level of racism and segregation and trauma that exists here, which is going again another case for the intersection of the important role that mental health plays within the reparations conversation, is that historical trauma has been carried from generation to generation, right? And we're not talking about those things. And I think that should be a part of the conversation as it relates to reparations, especially for Black folks who have witnessed. I have seen it myself growing up here in the early mid-70s when I came to this country. I was told to go back to where I came from. In fact, one of my white neighbors sicked his German Shepherd on me, knocked me off a bike, and bit me. And so those are the sort of things when you think about hate and you think about the racism that is so deeply rooted here in the city of Boston, we have to make a case for reparations while also uplifting the importance of mental health and wellness, because those two things are interconnected.
Fantastic. I think we should bring you into our community. And I think, to that point, that the mental health really matters and trauma really matters, at FXB, we have really followed Darity and Mullen's notion that reparations requires, that the wealth gap is tremendous, and that a money transfer and a material impact of the sort of the long-standing inequities in wealth really matter for health.
Right.
Do you want to speak a little bit to that, Mary, as to
Sure.
how that comes out?
Sure. So for the audience that isn't aware, Darity and Mullins published a book actually during COVID called From Here to Equality, which made the case that the best single metric of the impact of nearly 250 years of enslavement and then nearly 100 years of Jim Crow laws was the black-white wealth gap, which is much larger than the income gap. It's more or less 10 to 1 as opposed to 2 to 1. So they made the case that eliminating that gap at household level was the goal of any reparatory action. Now, I think that they make a good point. When wealth is part of the sort of household security, whereas sort of income is your running costs, wealth is your cushion and your barrier against hard times. It enables you to weather hard times and have confidence in the future. So arguably, a lot of the mental health costs associated with the impact of enslavement could be addressed by addressing wealth, not income, but by addressing wealth. But of course, there are other things that were greatly underinvested in, not just at household level. So the schools, which you mentioned, the housing market, which you've mentioned, with the way in which employment is structured, transportation. All of these things are not really individual attributes that a household could be expected to address, but are community-wide attributes. So I think that we really need to think about all of it. But the price tag on the Darity model is something like $14 trillion. So, they would argue that that would be a good place to start. That's a national program.
Could I say something
Oh,
really quick?
please.
I am about to take over your show here because I want to
You should. Go for it.
Because, Mary said something really interesting, and I think that health is wealth, right?
Okay.
And if you don't have a quality of life that is healthy, then you're never going to really reach your wealth milestones, right? Even looking at the type of housing that you live in. There's one woman that we've been working with. She's lost 4 days of work because she's had to take her daughter to the hospital. And the reason why she's had to take her daughter to the hospital is because she lives in a rat and roach infested environment, right? And all of these things are interconnected. Now we are messing with her dollars, if you will, by exposing her to in those living conditions, right? So all of these things are really interconnected. And what's happening in the reparations conversation, this is why every time you guys invite me, I always say yes, because there is an intersection here. Health has to be a part, and if not the anchor, of this conversation, because people are not going to do well unless they are well. And I think that this is why I keep coming back.
Well, thank you for coming back. But to Mary's point that, this 14 trillion or 11 trillion, whatever, that huge figure, Darity and Mullins say, local initiatives, you shouldn't call those reparations, because really that type of money only the federal government has. How do you respond to that? Like, what is Boston's role? Why a local reparations commission? Or should we all just join forces and go for the federal one?
I think as a municipal leader, I think that a lot of the things that I do on the municipal level, I see it. And I think that there's a role for all levels of government to play. We can't just, this is the problem, is like we're doing this, instead of everybody realizing, well, I can work on the Boston Public Health Commission, and I could work around the workforce development in schools. What can I do on the local level that really gets at reparations, or it really gets at kind of improving the quality of life for folks? I think that there is a role for the municipal level to play in terms of enforcement. And I also think that we have a budget that we pass every year. And if we're not looking at the budget and seeing where are those gaps, then we're missing the opportunity to really incorporate reparations into these conversations. We established a task force, and we only poured in, I think it was less than $500,000 for a reparations task force, which doesn't even get us to where we need to be. In fact, I established the Black Men's the Black Men's Commission in the city of Boston, and that came with a budget of $1.6 million. But Reparations Task Force is only $500,000. So there's something here that is like off for me in terms of the investments that we're not making in the conversation.
And there also have been local level harms,
That's
right?
right.
You know, of course, a lot of what we talk about after the end of enslavement, 1865, and the legal mechanisms that led to this huge wealth gap that we've talked about were mostly federal government, but they also were local, state and city governments. And so there is a case to answer for, in my opinion, at local level. And so that's why it makes sense to me to talk about, and plus you have to start somewhere, right?
That's right.
So I think that's what the various, and there's others in Massachusetts. There's one in Amherst, for example, that got started first, and now Boston is there. As you say, Boston is remembered best for its behavior during school desegregation, which has gained it this reputation as, despite being a very liberal city, one of the most racist cities in the country. So yeah, I think you make a good case.
Yeah, and on the state level too, I'll just give you one quick example. There was a family who was afraid to ask for help. Their lights had been turned off for a few weeks, and their children were not able to take a shower. And the nurse, it was at my daughter's previous school, the nurse had called and said, there's this family that's in need. The mom was afraid of reporting this because she thought that DCF was going to take her kids away, right? So there's so many systems of oppression right now that maybe we're not dealing with enslavement, but we're looking at the criminal justice system. We're looking at housing. We're looking at, policies that are in place around DCF. All of those things continue to cause harm to families instead of helping them. The fact that this mom couldn't take her kids, getting them showered because she was afraid that they were going to be taken away, that speaks to the amount of work that we need to do here on the state level to make sure that we're repairing harms and protocols and policies that prevent people from seeking services. There's a lot of work to do.
Can I ask a question here? Because it's interesting to me. I mean, there are all of these domains that you've mentioned. You've talked about housing and transport and jobs and so on. But one thing that I think public health can bring to this is the idea that this is when we'll know that we finally solved it. When we no longer see these gaping disparities by racial ethnic group. Right, we can't ever guarantee everybody the same level of health on an individual level. Bad things happen. But these group differences that mean that the Boston Public Health Commission has shown that Roxbury, certain census tracts, I think the catchphrase with 2 miles and 22 years or 23 years of difference in life expectancy. So between the Back Bay and Roxbury, those kinds of differences should not exist.
That's right.
And that's when we'll know that this country is finally taken, or the city is finally taken, because it will take both. Does that make sense to you?
Absolutely. I mean, even looking at diabetes and high blood pressure, and then looking at all the food deserts that we have in our communities, right? When you're thinking about, like, a lot of the local convenience stores are filled with, processed foods. Like, we're lucky now that we start having farmers markets, but access to healthy foods should be part of the conversation. Like, I thought that organic. I remember when I lived in New York, my roommates had like organic syrup, and I was like, I don't want that. I want the real stuff, and that was the real stuff, right? So I think there's something to be said about our own quality of health, and we can be in our last dying days before we go see a doctor, because especially for people who are low-wage workers, they're not going to miss a day of work to live a little bit longer. I mean, these are the decisions that people have to make every day, which is why I think making a case for health, because the social determinants of health determines everything in terms of your quality of life. So yeah, absolutely.
So we are at the Harvard T.H. Chan School of Public Health. A lot of people in the audience are students or researchers. So I'm going to transition us a little bit to a question to both of you. You know, what role can researchers play in bringing about, you know, policy change or working with community organizers? And, you know, Julia, the question to you is really, were they successfully involved in Boston? And Mary, more broadly, like, what message do we have to the audience?
Yeah, so for those who follow me, you know, I'm deeply rooted in community. So a lot of the folks that we worked with were nonprofit organizations and community activists. We really wanted to take a community-centered approach because we wanted people to define for themselves what this task force was going to look like. But we did work with Dr. Vladimir and Dr. Jimadari, who really helped us on the research front, provided a lot of academic context to this, so that it was a really good partnership in terms of really developing a piece of legislation that we felt both met the moment and also valued community input, because we did not want to, throughout this process, replicate harm by saying, as policymakers, we know it all, which we don't. And so our goal was to really make sure that we were working in partnership. But the only thing that I would say is to researchers, right, those who are researchers out here, is that you have to be also culturally competent in terms of how you show up in certain spaces, from the questions that you ask or that you don't ask, and how you show up in spaces, because nobody wants to feel like a guinea pig. I know growing up in this neighborhood, it never feels good to feel like you're being analyzed. And so I think that there's a lot to learn in terms of what research looks like and how do you do it in a way that really is sensitive to the people that you're working with.
And Mary, what does a research agenda on health and reparations look like to you?
Well, I want to make a plug before I get to that for surveillance, for the collection of routine data, which enable us to make statements like the gap between Roxbury and Back Bay, or the wealth gap, which the Federal Reserve Bank of Boston did a study. It's now a bit old and apparently being repeated, but those data are really valuable to public health departments and to policymakers, and it costs money, not a lot, but some, to maintain the surveillance that we need to make statements, to say what we were able to say about the COVID impact, for example. But beyond that, looking directly at the potential impact of reparations, I think, is an important thought experiment. And I'm aware of only 2 papers that have been published that look directly at the racial wealth gap. So there should be more. We started out talking about that. And with the support of the Robert Wood Johnson Foundation, which we started out with at the top of this conversation, we are engaged in that kind of modeling experiment. It's interesting because it's hard to model things that are really beyond the data. As many in the audience may realize, the wealth distribution of the black and white populations is non-overlapping pretty much. And that makes for a very interesting modeling challenge. But it seems to me that that helps us to imagine what kind of impact there would be. And it could be used to look at different questions like universal basic income or baby bonds or different economic interventions and what they would do to life expectancy. And that seems to me an important role for research, is to extend our imaginations. And it should be supported in the public health community. But obviously, there hasn't been that much, at least not yet. We're hoping to contribute to it at FXB.
Yeah.
So I want to ask sort of a question of, like, how hopeful are you that we can extend the imagination? The current climate feels a difficult one. So I want to ask you, where you feel on that?
You know, I am a eternal optimistic. Is that what they call it?
You have to be in public service,
I
right?
have to.
Or as an Afro-Latina.
And as an Afro-Latin, exactly. You know what? I believe, I don't know why, I have this sense of like, I really do believe that everything is possible. I think we just need to have the political will to move things forward. And so I move in that way. I've passed 15 pieces of legislation in 3.5 years. I've done more in my short time in office than most people who have been there for 20. And because it's really about the urgency of this moment. And I think that the moment that we fall victim to the narrative of how toxic it is, then we've lost. And so I think that the fight for equity has to continue to move forward, and I'm never going to give up hope. I mean, we're here. I'm at Harvard right now. Hello, right? So how is that giving up hope? Here I am, right? And we're having a good conversation about what we need to do to repair the harm.
Yeah. Well, I have one last question for the two of you, which is, when we think about reparations, people are talking about past harms that have ended, enslavement, but we know that there's ongoing structural racism and discrimination, and that the two aren't, they're linked. That's the legacy of enslavement. And how do we think about that? Repair when there's ongoing harm, and what do we do about it?
Yeah.
From a policy perspective, but also from a research perspective.
Yeah. Well, okay, Mary,
Go,
I'll go
you
first. So, I think that for me, the way I have worked on my policies has always been like leading by my own lived experience or those that I work with. And so my mom never made it beyond the 3rd grade, and she struggles with reading and writing. So we established a literacy task force in the city of Boston. The last time that we studied literacy rates was in 2003. Right? And we know that literacy, right, that if our kids are not knowing how to read and write by the 3rd grade, then we're feeding the school to prison pipeline, which is then another form of slavery, right? And so these two things, for me, is the intersection of how we continue to perpetuate harm, right? And so we're passing kids from grade to grade, they're showing up, and then they end up locked up. My hope is to dismantle the school to prison pipeline through that vehicle of looking at it through literacy. And people can't fill out a job application. Or if they go to, they don't know, when they go to the doctors, they don't understand the language. So we established a language access ordinance in the city of Boston, where everything that even though this is not for Black folks particularly, but it's something that I think will help everyone who English is not their first language. Like, all of those things can help support the social and emotional well-being of those that we serve. But I think that there's a lot of work to do in the policy-making space. And the only way we're going to get to where we need to be is if we're honest about our deficits. And I think that sometimes people aren't ready to own that.
Yeah. Mary.
Well, I sort of feel like I should give you the last word, but I think it's important to separate out harms that have occurred in the past for which there is no remedy except repair. Ongoing harms should be stopped. That's what you're talking about doing when addressing the criminal legal system, police violence, the way in which our job markets are segregated, our neighborhoods. All of those need to be addressed directly now. Part of the kind of simplicity of the Darity model is that the wealth gap takes into account contemporary harms, or because it makes the case that at household level, the reason that this gap exists is not only because people had nearly 250 years of uncompensated labor when they were enslaved, but all of the marginalization and exclusion that happened both through law and through practices afterwards. But that, the notion of reparations as a way of solving current discrimination seems to me not the way we want to go. The answer for that is to stop it and to work through the political system as you're doing, to ensure that we put policies in place that make real penalties for people continuing to break the law, because most of this is currently not legal anymore.
That's right. We didn't talk about maternal health.
Please.
I don't know if we have time.
We do.
but,
We
like,
do. We have 3 minutes.
Because that is also something that I think is really important as we're talking about health and here in reparations. You know that, especially for Black women, maternal health, people are literally dying to live, right? And you know, sometimes I had to have a C-section. I didn't want one, but I didn't know how to fight against it, right? So there's so much harm that's being done to women or birthing people that I think that there's a role for reparations to talk about the harm that we're continuing to do, and that could be an easy fix in terms of really making those investments. Right now, the Neighborhood Birthing Center in Boston is trying to open up, and I'm really excited about that. And I think that's going to be one of those reparative. If we're talking about reparations, that would be the
that would be
right.
That would take us straight into what is
$300,000. Because you know what, that's generational.
Is that all they're saying they need?
No, I'm just saying. I'm just throwing. No, they need millions of dollars. Okay, Harvard. But I'm thinking about the Neighborhood Birthing Center as a really great investment in the city of Boston. If we really want to repair harm, that could be a really great, I think, an investment there.
And we have had actually FXB students volunteering there to bring in their expertise in data and analysis to support this effort. And so I do want to give you the last word. These students live in Boston, or at least study in Boston. The School of Public Health is in Boston. What do you want them to take away? What should they do to bring all of this work forward?
Yeah. Well, you know, I dressed in my militant gear today, y'all, because I came here to fight. No, I think it's really important as we're having these conversations is to recognize that we're all playing a role in this. It's not just policymakers, you know, educators. I think that when we're starting to look and opening up the tent and recognizing that we're all responsible for each other, then I think that we can all roll in the same direction. So I just ask you all to be engaged in the process and to see yourself reflected in that outcome, because it's going to take all of us really working in different ways to have real conversations here in the city of Boston, because not everybody really wants to own it.
Well, thank you both for this really thoughtful conversation, for inspiring everyone in this room. And we are going to say goodbye to the online audience. And thank you for joining us. If you missed any of this, you'll be able to view it on demand on the Harvard Chan School's YouTube channel. And have a wonderful afternoon.